Sometimes I get asked this question, why don't you get breast cleavage even you have breast implant? Well, to answer the question is really multifactorial. But first, you have to define what is a cleavage or how much you consider is a cleavage. You can have a small one or you can have a large one. So to determine that, usually the patients say that there's no cleavage, usually because they put the implant under the muscle, because the muscle is what limiting the expression of the shape of the implant because the muscle. So therefore, putting the implant under the muscle, sometimes you have less of a cleavage. At the same time, you also need to have some elasticity of the skin, and also you need to have the framework of your breast, how they sit onto your chest. And sometimes it depends on how much fat you have under your skin. And the other one too also depends on the type of implant. Usually, to get more cleavage, you need to have a rounded implant as well as a high profile implant, the size of the implant and the shape of the implant. So those are the criteria that can create the implant. So it's multifactorial. Now, I perform mostly subfascial breast implant because of the subfascial, we don't have the limitation of the muscle. So therefore, I can really show the shape of the implant under the breast rather than under the muscle. So that's why that I perform subfascial breast augmentation, which give me a more natural look.